Well, Dr. Anthony Fauci is warning the U.S. could be at risk of another COVID-19 wave as the number of virus cases plateau in the U.S. The number of daily infections have hovered between 50,000 and 60,000, but at least 30 states, as well as Washington, D.C., have reported a rise in infections in recent days. Let's bring in Dr. James Simmons. He is a hospitalist nurse practitioner. Doctor, how concerned are you about the uptick that we have seen in these individual states? The number is much lower when you compare it to the peak at the end of last year. But we've heard Dr. Fauci repeatedly warn that when you plateau at a long rate here, that's not necessarily a good sign.
Absolutely. That it's not really a good sign, at least in recent history, because what's happened after we've had these sharp peaks is we have these plateaus and then we start to go back up again. And so, I am concerned. Dr. Walensky has been saying this from the beginning, that states were opening too fast and too aggressively. So states like Mississippi and Texas, who completely lifted mask restrictions in their entire states, are unfortunately part of what I think is driving these numbers to plateau. And like you said, at least 30 states and the District of Columbia, numbers have at least plateaued, if not starting to go back up. So I do have some concern with this as well. We don't have the genetic sequencing in place the way we would like to understand how much these variants could be at play here in terms of the variants driving this versus is it our actions and lack of masks, lack of physical distancing. Regardless of what's driving it, we see that the numbers are plateauing, and we've done this now 3 times before where the numbers have plateaued and unfortunately they start to go up afterwards.
What's different this time, though, of course, we have a significant number of Americans who've now received at least one dose of the vaccine. We have the CDC coming out today saying that the first dose of the Pfizer or Moderna vaccine is about 80% effective against the virus. So does that change the calculation in terms of how to handle this recent wave, just given how many people are already vaccinated?
I think all it really does is tell us that we have to put our foot on the gas pedal even faster with these vaccines. Surveys are showing that Americans' receptiveness to receiving the vaccine, getting the vaccine, is going up every single week. And that's fantastic. And I think it's because we repeatedly see things like the CDC study that show that even after one dose, the vaccine really works tremendously. And we are in a foot race, and we are neck and neck right now, I believe, in getting to herd immunity via vaccinations and staying ahead of these variants and making sure that these numbers that we just talked about actually stay in a plateau versus starting to rise. So even if it's getting individuals to a place where they get at least one vaccination to start, I think we're literally on a day-by-day basis with this. And I think it's tremendous news to hear that.
You're out in California, where the state recently expanded the pool of those residents who can actually get the virus. But now you're starting to deal with a part of the population that is not as comfortable getting the vaccine themselves. A lot of hesitancy as well. I'm curious what you're seeing firsthand on the ground there, and how much progress has been made in trying to convince, especially communities of color, to get the vaccine.
Absolutely. I think that the numbers are really changing. And I actually had a really great conversation with individuals from the Los Angeles County Department of Public Health over the weekend about how we're seeing a tremendous increase in the numbers of individuals from Black communities and other communities of color in terms of receptiveness to and actually getting the vaccine. So in LA County right now, the number of African-American individuals who have gotten the vaccine is up 125% just versus weeks prior. So the information is out there. And I think what's really important is that you have to get the information into trusted sources' hands, into individuals who lead faith-based organizations, community-based organizations, and places like LA County, which have pivoted and said, okay, we have to have something of a different vaccine distribution rollout to reach these communities who have been hesitant in the past, and do it in a way that really works for those communities. They pivoted, they're doing that, and now we're seeing tremendous growth in the number of individuals who are getting vaccinated. So I think it's really a model that other places around the country can look to increase numbers of vaccines in all communities.
And finally, Doctor, we've got this report out from the AP that looks at a draft copy of this WHO China study looking at the origins of COVID-19, suggesting that the transmission likely happened from bats to humans. What do you make of that? report, especially given China's involvement in the report itself? And ultimately, why is it important to get to the conclusion, to get to the root of the cause?
Well, getting to the root of the cause really helps us prevent something like this happening in the future, right? And that's really the why we are trying to do this. But unfortunately, even if we look at the Ebola virus, we've spent more than 40 years trying to find the roots of the Ebola virus, and we've not been able to find it. So I think it's really important for folks to understand that these things take years and years. This report that is released does come with a lot of controversy. China has had their hand in this report, and it has been delayed multiple times, bringing up some suspicion. I think ultimately the conclusions of this, that the virus likely came from bats through another animal and then to humans, it's the most plausible explanation for this. Other individuals have said things like maybe this virus was released from a lab. Unfortunately, even Bob Redfield, the immediate former director of the CDC, said this. We don't really have evidence of that right now. But there's also good reason to question this report and to really look at the fine, the small writing of this and the details of it to really see if this report is telling us what's actually going on and what happened.
Dr. James Simmons, it's good to have you on the show today. Hospitalist nurse practitioner joining us from LA.